Drug-induced liver injury can occur following the use of a variety of either prescription or over-the-counter medications. A high index of suspicion is often necessary in establishing the diagnosis. Early recognition of drug toxicity is very important to permit withdrawal of the offending drug, assessment of severity, and also monitoring for acute liver failure. Drug-induced liver injury can be dose-dependent or idiosyncratic, and the hallmark for the treatment of drug-induced liver injury is early withdrawal of the offending drug. Causes are allopathic drugs, for example, prescription, over-the-counter medications, anesthetic agents, and other drugs like paracetamol, statins, isoniazid, halothane, amiodarone, azathioprine, carbamazepine, phenytoin, nevirapine, ketoconazole, and also flucloxacillin, and several others. Herbal preparations and also dietary supplements could lead to drug-induced liver injury. Symptoms are right upper quadrant pain, nausea, anorexia, malaise, lethargy, pruritus, and it could be asymptomatic too. Signs that are usually elicited are jaundice, stretch marks, bruising, hysterexis, altered mental state, and also signs of pre-existing chronic liver disease, and occasionally none. Investigations are FBC, LFTs, BE creatinine, INR, serum glucose, urinalysis, hepatitis screen as ABCE for exclusion, and also abdominal ultrasound scan. Treatments. So the treatment objectives are to identify and withdraw the offending agent, to report as adverse drug event to the Food and Drugs Authority promptly, and also to assess severity of the liver disease, and to administer antidotes where applicable or feasible. For pharmacological treatment, it depends on the type of drug, but for drug-induced liver injury following paracetamol toxicity, the first line treatment, you give N-acetylcysteine, and yeah. So the referral criteria: all patients failing to improve or showing progression in liver injury despite withdrawal of offending drug should be referred to a specialist.